They are really caring. Yeah, they're really caring for our health so that we can have good life. Yeah, I have enjoyed their conversation.
My name is Roy Bore, and we at HealthX need your support in providing a doctor for every Kenyan. Why shouldn't an individual be able to call at any one point, anywhere, any time of the day to speak to a doctor? That's why we have provided the toll-free line, the app, and more importantly, the virtual clinic. We believe that with the price point and the affordability of telemedicine through HealthX, Kenyans will be able to access medical care of high quality regardless of where they are, regardless of whether you're sitting in Nairobi in your swanky office to the person or the goat herder in Turkana or West Pokot.
To me, this ambition of having a doctor of every Kenyan means that it doesn't matter where you are in the country, how much money you have in the pocket, you will get quality healthcare services when you need them.
It's not only going to be the 20% that is covered by insurance that will access quality healthcare anymore, but it's going to be every Kenyan that lives in Kenya that can now access quality healthcare.
WHO recommends one doctor for every 1,000 people. Statistics for Kenya show that it's 1 to 4,000, but when I go to the counties, the picture is quite dire because in some of the counties I've been, it's 1 to 90,000, 1 to 94,000 in some cases.
So for example, what we are doing in Nandi County, there's still a gap when it comes to the medication there. They don't have all the lab work that we wish we could access or offer our patients. But don't forget that every patient at the end of the day is seeing a doctor, a qualified doctor. They're getting very good information depending on what they're suffering from. It's no longer just a guy in a dispensary they met, but this is a qualified doctor.
My name is Canisius Yego. I was the first patient of the HealthX Africa, Kapsabet County Referral Hospital. I felt that the quality of the treatment was good. The technology is very clear. So I felt like I was just seated next to a physical doctor, although the doctors were far, but I could feel that touch of a doctor.
This can be able to transform communities, not just in the urban areas, because of the concerns around mental health in the urban areas and also sexual and reproductive health, where there is stigma in people connecting with a physical doctor, but also the communities who are very vulnerable and because of war and cattle rustling and also hostilities in these communities.
It gives me joy to see that health services, and especially mental health services, because that's where I'm coming from, is accessible to every Kenyan in this country.
Strategic partnerships are important to us in terms of helping us attain this very ambitious ambition. Talking about partnerships with organizations which share similar passions or similar ambitions. This could be in specific programs, public health programs like maternal health, child health, or just generally in achieving universal health care for all Kenyans.
Simply put, we would need buy-in from key stakeholders. And that is you. You need to trust that we know what we're doing. And you need to trust that even if it's a new concept, it's for your benefit. Try it and see.
Call or email us today to explore how we can impact the lives of more people together.